Dr. Sumana Datta. I am a consultant gynecologist and obstetrician at Narayana Superspeciality and Multispeciality Hospital, Howrah. My main areas of work, special interest areas are high risk pregnancy and laparoscopic surgery and gynecology. Today I will be speaking to you about high risk pregnancy in detail. High risk pregnancy, what exactly is high risk pregnancy? High risk pregnancies are those conditions which during the continuation of pregnancy entails a high risk to the mother and the fetus. These conditions can be, we can broadly classify these conditions under two headings, mainly women who have a known or a chronic pre-existing medical problem, and the second group is women who do not have a pre-existing medical problem but develop a new medical condition during the ongoing pregnancy. So what are who are the women who are at a already have pre-existing medical disorders? These are women with known hypertension who are already on treatment or may not be pre-diagnosed or are diagnosed for the first time during pregnancy. Second is women who have certain endocrine problems like diabetes, thyroid problems, which could be a hyperthyroid state or a hypothyroid state. Women with renal disorders, women with neurological disorders, but especially epilepsy. Women who have respiratory problems including bronchial asthma or COPD. Women who've had a autoimmune disorder like SLE or connective tissue disorders who are already on treatment. These are women who are at a special risk because they already are on medical treatment and the treatment needs to be optimized prior to planning a pregnancy. The other groups are hematological disorders in which women might have thalassemia, might have sickle cell anemia, or they might be a chronic or an acute ITP which is discovered either pre-pregnancy or incidentally diagnosed in pregnancy. There could be also a previous pregnancy complication which has happened in, or a mishap which has happened in the previous pregnancy, like a previous stillborn baby or a previous baby who's had a immediate neonatal death, that is the baby died immediately after delivery, or subsequent or repetitive pregnancy losses. In these conditions, definitely the next subsequent pregnancy comes under the high risk category. Women who do not have any pre-existing medical problems can develop certain medical problems during pregnancy. That happens because of pregnancy induced hormonal changes and placental changes. So what are these medical problems? These are known as gestational disorders. These are like gestational diabetes, that is a woman who is not known to be diabetic suddenly develops diabetes at around 20-24 weeks and thereafter, that is mid pregnancy onwards. The second can be hypertensive disorders. In a woman who is not hypertensive suddenly starts spiking in her blood pressures, that is around the 7 months or 6 months of pregnancy, suddenly we notice that the blood pressures are rising. She needs investigations and further specialized treatment. The other groups are multifetal gestation, that means higher order pregnancy, that means women who are carrying more than one fetuses, that is twins, triplets, or even higher order. These there can be other baby or fetal associated problems which could relate to the baby's growth. That means the baby could be small for dates, that is the growth might be suboptimal, that is lesser than normal, or it could be an accelerated growth wherein we call the baby as large for dates. The other problems that would be related to the liquor, that is the fluid around the baby could be abnormally high or could be abnormally low, which can put the baby at risk. There could be also some placental issues wherein the placenta could be abnormally low lying, that is covering the lower part of the uterus, wherein it can bleed at any point of time and which can threaten the pregnancy and the mother. So what happens if the baby, if the pregnancy is a high risk pregnancy? What special treatment do we need? What do we need to be aware about? First thing that I would like to emphasize is all women, whether be it low risk or high risk, need to come for a pre-pregnancy consultation. If not, if they don't get that opportunity or if they miss that, at least a very early pregnancy consultation as soon as we have a positive pregnancy test. High risk mothers who already have a medical problem and are aware of it should go for a pre-pregnancy consultation, wherein just prior to planning you could come to us wherein we can tailor your therapy so that the medications which are safe during pregnancy, we ensure that you are on such kind of drugs, because certain drugs can cause problem to the baby. So we shift you to safer medications just prior to planning a pregnancy, and we can also optimize your medical therapy so that your parameters are well controlled, your blood pressures are normal, your thyroid levels are normal, your sugars are better, so that the baby does not have problems because of these. In patients who do not have any risk factors, what we do in a preconceptional counseling or a counseling before pregnancy is we check for certain disorders, that whether you are having certain endocrine problem, or are you hypertensive, or do you have any blood related problems. If these are found, then these can be treated, or we could counsel you as to what needs to be done, so that we are ready prior to your embarking on a pregnancy, so that we do not in any way threaten the outcome of the fetus in the first half of pregnancy. Knowing all that, what else is important in high risk pregnancy? In high risk pregnancy, we need a team approach, that is an obstetrician who is skilled in treating high risk pregnancy, along with a team of medical specialists. Depending on the patient's medical condition, we get in a team of consultants who are there to help us out with the medical problem. So it's always a team approach. It's not that me alone would be treating that patient. We would require another co-specialist help from another specialty to help us with the medical problem as and when it arises. So it's always a team approach and always an institutional delivery. That is, the patient should be delivered in a multidisciplinary unit like we have in our setup, wherein we can give her the best of outcomes from the medical point of view, from the fetal point of view. The mother and the baby both are at the best outcomes. So far as the team approach, the second goes is when these patients are delivered, the high risk mothers, their babies do usually need a special care, because most of the times they need to be delivered a few weeks before their scheduled dates, because the medical problems tend to worsen in the later half of pregnancy, no matter how well we treat it. As the pregnancy advances and it crosses around 35-36 weeks, the problems tend to increase, and they tend to affect the baby if they are not delivered early. So when we need to deliver them early, we need a good NICU setup, that is a neonatal ICU, particularly a level 3 NICU, wherein we have a team of dedicated neonatologists who will take care of those special babies, the preterm, the low birth weight, and those babies of high risk mother. Our setup in Narayana Superspeciality and multispeciality caters to this kind of high risk mothers. We are dealing with all kinds of medical disorders, cardiac problems, surgical problems if there are any during pregnancy, and we cater to a large number of high risk. Our main obstetric work in this unit is to high risk mothers. The team approach is very essential so that we give the best outcome for the baby and the mother in spite of this existing medical problems. Thank you.